Joining us is Dr. Matthew Kaag, Chief of Urologic Oncology at Penn State Health. We often talk about survivorship, cancer survivorship. Really, what does that mean?
So cancer patients are living longer after their diagnosis. Our treatments are getting better, and particularly in prostate cancer, more and more patients are being cured. So we firmly believe that cancer care doesn't stop after the treatments are done. A lot of patients have ongoing issues that are caused by the treatments that they have, whether it's incontinence after surgery or fatigue because of maintenance chemotherapy or hormonal therapy, and those patients need to be supported, and that's what survivorship's all about.
So tell me more about that post-treatment. What are some of the challenges that these patients face beyond what you had just talked about?
Sure. So common complications after having the prostate removed, for instance, would be urinary incontinence. It's often transient. It'll get better over time, but it can be very annoying while it's there. Men can have erectile problems afterwards, issues with sexual function, and also just the psychology of knowing that you've had cancer can cause some issues. Patients that are getting chemotherapy or hormonal therapy can deal with fatigue, difficulty with appetite, etc.
You know, at that point, how important are friends, family, supporters?
Oh, incredibly important. I really can't stress enough how important it is to have, a supportive group of people around you. Human beings are social animals. We heal better when there are people around us to provide psychological support and physical support, and the nursing care after surgery and after chemotherapy is very important.
Well, and as Dr. Rahman was saying, the survivorship groups, that's another example of the support that needs to be given.
Correct.
Let's talk about, again, long-term outcomes. How much does diet, exercise, at that point, does that play an important role?
Absolutely. So I tell my patients in clinic all the time, you can't possibly understand how important it is to go into these treatments healthy so that you can tolerate them better and recover from them faster. Our goal is always to get the patient cured or through the cancer treatments, but then also get them back to full function afterwards. So we want them as healthy afterwards as they were before.
Very good. Okay, well, you're going to stay here, Dr. Kaag, because after the break, we're going to talk more about the importance of those support groups. For more information, or if you would like to make an appointment with Penn State Health, call 717-913-2893. We will be right back. Back with us is Dr. Matthew Kaag, Chief of Urologic Oncology at Penn State Health. Let's talk about those support groups that we mentioned. How are those support groups specifically helping urologic cancer patients in terms of the emotional, aftermath of this?
So as a physician, I've treated thousands of cancer patients, but as much as I know about the disease, I can't talk to you and say, I've been through this myself. And that's really what the support group provides. People that have been through the physical trials of it, the psychological strain, and they can relate to the patients and give them tips and tricks, whether it's something concrete like how to deal with incontinence, or whether it's just knowing that there's someone else that's been through what you're going through.
Yeah, in every aspect of your life, when you're able to talk with somebody and go, oh, me too, it's very uplifting and reassuring. Can you give me any sort of examples of where you've seen this work or how you've seen it work?
So I've been very involved with our bladder cancer support group. Our prostate cancer support group is new and growing rapidly, and it's a very sort of heartwarming feeling to see these patients come together. A lot of people in central Pennsylvania don't enjoy talking about the nuances of their health, particularly private things like urologic diseases. And to see a patient walk into the support group, maybe a little hesitant to join, and immediately be accepted and see them walk out feeling like they've gotten something out of the interaction is fantastic.
Yeah, maybe it lightens their load just a little bit. And then No Shave November, the funds raised go to help the activities that your team puts on. How do you think that this makes such a difference? How does it make you feel?
It feels fantastic. I have a hard time asking people for money if we can't show them where it's going. And as was sort of talked about in the earlier portion of this segment, the fact that we're doing something tangible for our community, the generosity of the people in central Pennsylvania is getting pumped right back into that patient population. That's the way it's supposed to be done.
That's great. Good to have you back on the show.
Thank you so much.
Great. For more information about the Prostate Cancer Support Group, call 717 717-531-1132. And for the bladder cancer support group, call 717-531-0003, extension 285863.